Okay,
All
Amanda.
right. Very good. Good evening, everyone. Buenos tardes. Thank you so much for joining us tonight. I'm so happy to introduce our speaker tonight, Derek Dislover. Did I pronounce your last name correctly?
Dislover.
Dislover. I apologize for that. Thank you.
Fine.
He is a perioperative nurse from the University of Michigan, which is a very large academic hospital here in the United States. So he'll tell you a little bit about perioperative nursing here in the United States.
Yeah, so I'm
Derek, just to remind you, I
Yes.
will be taking over to do the translation in between, so just keep that in mind.
Perfect.
Ok, buenas noches a todos. Amanda estaba saludando a nuestro presentador de esta noche, Derek, que es uno de los enfermeros de la prestigiosa Universidad de Michigan, trabajando en los servicios perioperativos, una universidad, uno de los hospitales más grandes en los Estados Unidos. Pero nos va a acompañar esta noche. Okay.
Okay, thank you. So Derek, can you tell us a little bit about yourself and how you got into nursing?
Derek, cuéntanos un poquito sobre usted y cómo empezaste, por qué entraste a enfermería. Sorry.
So I've been a nurse for 20 years. My mother was a nurse, and the field was a desirable field. I came upon it naturally.
Llevo ejerciendo enfermería 20 años. Mi mamá era una enfermera y eso hizo que para mí la enfermería se volviera algo natural para estudiar.
So 20 years is a good time in the field. Tell me, have you always been perioperative nursing, or how has that evolved over your 20 years as a nurse?
So I've been an intra-op surgical nurse for 17 years. And prior to that, I was a nurse on the cardiac floor for 3 years.
Wow. Amanda le dijo, 20 años en el área de enfermería. Desde el comienzo ha sido un enfermero en el área perioperativa. Derek contesta que él lleva 17 años como enfermero en las áreas perioperativas. Los primeros 3 años de su profesión los pasó en las áreas de cardiología.
So 17 years in perioperative services. A lot of the nurses here will be coming to America, and they're always interested, like, how did you get started in perioperative? Was there training? Is this something that you were able to go? I know you started in cardiology. Did you need to have experience to get into perioperative nursing?
At that time you did. Now they don't. Now they take nurses right out of school. The training for a full-time intraoperative nurse is typically about a year, but that's to do multiple areas of the job.
Okay. Cuando Amanda le preguntó, empezaste en cardiología, pero ¿qué tuvo que hacer para poderse transferir a las áreas de perioperativas? Derek dice, en ese entonces sí había que transicionar desde una unidad a la otra. Hoy en día no. Hoy en día ya reciben enfermeros directamente que se han graduado de las universidades directamente a las áreas perioperativas. Obviamente el entrenamiento toma aproximadamente 1 año y hay que rotar por todas las áreas del servicio.
So tell us, with that training that you're training to do cross-train throughout the surgical division, what all does that entail? Can you tell us a little bit about the different areas within the surgical division that you are cross-trained in?
Yeah, so I just work inside the operating room. So I'm in every surgery, and I'm either assisting the surgeon or doing what's called a circulating nurse. There's two main areas where nurses work in the OR, as what's called a circulating nurse and a scrub nurse. So you're either scrubbed in directly assisting the surgeon, or you're circulating where you're assisting the surgical team, but not directly with the surgery.
Okay. Amanda le preguntaba en qué áreas estás trabajando en este momento, y Derek decía, en este momento estoy trabajando directamente en las salas de cirugía. hay dos tipos de labores que se hacen en particular. Uno es lo que se llama el enfermero que asiste directamente al cirujano durante la operación, ¿okay? Que se llama el scrub nurse, la enfermera que está atendiendo directamente en la operación. O la otra actividad que hacen es lo que se llama la enfermera circulante, que es la persona que no está directamente asistiendo a un cirujano durante la operación, pero que está circulando, ayudando a las personas, el equipo de cirugía que está trabajando en ese momento. Okay.
So
Luis me comenta que eso se llama en español un enfermero quirúrgico o un enfermero instrumentista. Okay.
So with your position, Derek, then you can either go between the circulating nurse and the scrub nurse. So tell me, kind of, can you explain to our nurses from Latin America to see if there's any difference between how a day in the life of a nurse here in the United States is maybe compared to that in Latin America? Can you kind of walk us through how your day would be, kind of what the process did you go through? How many surgeries are you typically in a day in a 12-hour shift?
Derek, let
Yes.
me translate that for a second.
Yeah.
Amanda le pregunta a Derek, okay, para poder contrastar un poquito cómo funcionan las cirugías acá y en Sudamérica, él está pidiendo, Amanda, que por favor describa un poquito cómo es un día de un enfermero en el área de cirugía para que ustedes puedan contrastar las similaridades y las diferencias entre los dos. Sorry, Derek, go ahead.
No, that's fine. So in a typical day, a nurse would assist on anywhere from 1 to about 6 surgeries, where I work 12-hour shifts. One surgery could last 12 hours, or you could have 6 surgeries that last 2 hours each.
Okay. En un día normal, un enfermero normalmente asiste. Él trabajan 12 horas, como ustedes saben, los enfermeros trabajan 12 horas, ellos pueden o asistir a una cirugía que puede durar 12 horas o pueden asistir, por ejemplo, 6 cirugías que cada una dura 2 horas.
And what are some of your roles that you have during that operating time? So you receive the patient in from the pre-op, and then as a nurse there, depending on being a scrub or circulating nurse, kind of what would your duties be for that case, let's say?
Sorry.
Cuéntanos en poco más detalles cuáles son las labores que haces desde el momento que el paciente entra a las áreas de cirugía.
As a circulating nurse, you're with the patient throughout the entire process. So you bring them from the pre-op area to the OR. You assist with anesthesia in anesthetizing the patient. You prep the patient for surgery, prep and position the patient for surgery. And then during the surgery, you get the surgical team anything that they would need throughout the entire surgery. And then afterwards, you help bring the patient back to the post-op area.
Como enfermera circulante, se recibe el paciente desde las áreas preoperativas y se trae a las áreas de operaciones, ayuda a tanto anestesia, obviamente a anestesiar al paciente y a posicionar al paciente para la cirugía. Parte como la enfermera circulante, una vez que el equipo empieza la operación, parte de la labor es estar seguro de que el equipo tiene todo lo que ellos necesitan para completar las cirugías.
And to do that intraoperative nursing, as you're describing, that does not take a year of training, correct? How long does typical training for that take?
Para ser un enfermero en estas áreas, ¿cuánto en realidad toma entrenarse y prepararse para hacer esta labor en particular?
That's correct. So the two areas I spoke of, the circulating nurse and the scrub nurse, a travel nurse can be taught to be a circulating nurse in 2 to 3 weeks. Whereas it takes a lot longer to be taught to be a scrub nurse.
Okay.
So there's a lot more intricacies in being a scrub nurse.
Okay.
So most travel nurses would be taught to be circulating nurses only.
Okay.
And that would take 2 to 3 weeks.
Okay. La primer entrenamiento obvio es convertirse en un enfermero circulante o una enfermera circulante. Normalmente entrenar a una persona para que pueda funcionar como un enfermero o una enfermera circulante toma normalmente él estima unas 3 semanas. En ese momento ya las personas saben más o menos todo lo que se necesita para asistir y hacer parte del equipo que ayuda a las operaciones en más o menos unas 3 semanas. Para ser la enfermera que está instrumentista, los que están dentro de esto, requiere mucho más tiempo y ya nos va a describir. So, will you describe for us what it takes to become not a circulating, scrub nurse, I'm sorry.
Yeah, a scrub nurse is specific training specific to each service of surgery, where you're learning how to assist the surgeon directly with the surgery, which includes passing instruments and helping with the actual surgery.
Okay, yeah. Could you give us a tiny bit more detail on that?
Yeah, so a surgery might have like 100 different instruments.
Mm-hmm.
And you have to set up those instruments, all sterile instruments. So
Mm-hmm.
you have to set up everything, and we follow like a recipe card. Like if
Mm-hmm.
you were making a cake, you know, every surgery has a card. You follow the card, you open whatever the surgeon wants, and you prepare it for them to use throughout the surgery. Throughout the surgery, you're working hand in hand with them, helping them with the instrumentation throughout the entire surgery.
Okay. And is a specialty specific, correct? Okay. Derek nos contaba que para volverse un enfermero instrumentista, obviamente requiere mucho más entrenamiento. Se hace a nivel de las diferentes especialidades. Parte del proceso obviamente consiste en tener todos los instrumentos y equipos que se requiere para la cirugía, que el cirujano va a querer utilizar durante la cirugía, obviamente preparados y listos. En ese momento se trabaja mano a mano con el cirujano para obviamente tener todo lo que se necesita y hacer todos los detalles que se requieren para lograr y asistir durante la operación. Yo le preguntaba a Derek que obviamente que nos confirmara de que eso era, el entrenamiento es específico para cada especialidad. Dice que efectivamente se vuelve uno, se va preparando para cada una de las especialidades. Okay.
So Derek, sorry.
No, yeah, just was letting you know that I said that obviously you'll train for each one of the specialties.
Okay, so that was gonna be, yeah. So you, as a scrub nurse, you have to train, you'll be trained in cardiac, you'd be trained in orthopedics and all that. So do nurses get to identify or kind of dictate which specialty they'd like to be trained in, oriented in?
Is he gonna
Oh,
translate?
sorry. Do you want to translate that, David?
No, because I kind of already said that. Go ahead and.
Oh, you did. Okay.
Okay. At the University of Michigan, the management team chooses what specialty you'll work in. You can apply to work in certain areas, like cardiac is different than general surgery. So I don't work in cardiac surgery. I work in more general surgery and neurosurgery. But yes, you can apply to work in certain areas of surgery, but once you're in that area, they choose which specialty that you'll be in. But you could always, you know, there's you could request to be in a certain specialty.
Amanda le preguntaba a Derek que obviamente si uno escoge la especialidad que quiere o que si obviamente los supervisores escogen. Él dice que obviamente uno puede solicitar trabajar en un área específica y está entrenada. La cuestión es una vez que uno está entrenado para una especialidad en particular, normalmente no hay mucho cruce de una a la otra, uno básicamente trabaja dentro de la especialidad. Él trabaja, por ejemplo, en cirugías generales y neurológicas y él, por ejemplo, no cubre, daba como ejemplo que él no cubre nada que tenga que ver con el experto, con las cirugías de cardiología que hacen. Derek, one question that comes to mind right away on that is, what happened when you are late at night, you are covering? I'm assuming you have to do some coverage every once in a while. When do you keep people from every specialty? Do you have some generalists, or there are certain surgeries that will never occur at certain times of the day?
What they do is they keep people from every specialty.
They keep.
If there's call people, they're call nurses are specialty specific. So a nurse is not going to go into a surgery and not know the specialty.
Okay.
They'll be called into a surgery that they're specially trained for.
Okay, so you always keep people on call for each specialty, but in general, for example, in the after-hour shift, do you keep only certain nurses because those are the more common cases that they cover?
Actually, at the University of Michigan, they keep every specialty.
They keep every specialty.
Yeah,
Okay.
there's members, there's nurses from every specialty there from 7 in the morning till 11 at night.
Until 11 at night.
And
Okay.
and even overnight to a lesser degree.
Lesser degree. Okay. Yo le preguntaba a Derek qué pasa, por ejemplo, para el cubrimiento de las diferentes especialidades a diferentes horas del día. Él dice que obviamente nadie va a entrar a una cirugía a hacerla en el enfermero instrumentista o el enfermero quirúrgico de esa, si no es parte de su especialidad. Obviamente una universidad, un hospital del tamaño de la Universidad de Michigan cubre todas las especialidades básicamente a todas las horas del día, desde las 7 de la mañana hasta casi la medianoche. Tienen obviamente activos a todos los, y dice que inclusive en las horas de la medianoche hasta las 7 de la mañana también hay enfermeros, básicamente todas las especialidades trabajando en el hospital en esos momentos, cubriendo las necesidades de los hospitales. A couple of people are asking already a few questions, which I believe I know the answer, but I'll let you. They want to know if you are paid by procedure, are you paid by hours, or you have a fixed salary? It's one of the questions.
Paid by the hour.
Yeah. A una persona pregunta que si le pagan por procedimientos o por horas o por un salario fijo, y Derek contesta que ellos les pagan por horas, lo mismo que el resto de los enfermeros del hospital. Yeah. Okay, you are on the same format as any other nurse in the hospital. They are paid hourly. Okay, very good. Amanda?
Yeah.
I actually have a question too. Derek, what about like how many hours as a full-time employee are you required to work? What are your shifts like? And how much call time do you have to take in a week?
So at the University of Michigan, I work 3 12s, 36 hours. That's all I'm required to work. Some nurses work 5 8s, so 40 hours, or 4 10s, 40 hours. But I work 3 12-hour shifts, and that's usually 7 in the morning till 7 at night. I take the least amount of call possible, which is usually for me maybe 1 day a month, so 1 overnight a month. Okay. At other hospitals, you could have to take more, but we have a lot. We have 200 nurses, so we're able to split the call time up.
Okay.
So some people like to take a lot of call, and some people like to take a little bit of call.
Okay. Shannon le preguntaba a Derek que cómo es su horario en particular de trabajo y si él tomaba mucho lo que se llama turnos por llamada cuando hay emergencias donde la gente está cubriendo o turnos de cubrimiento. Derek dice que él, como la mayoría de los enfermeros en el área, trabajan solamente los 3 turnos de 12 horas, sus 36 horas, que ese es el requerimiento de tiempo completo. Obviamente que hay algunos enfermeros que les gusta trabajar 5 días de la semana, 8 horas diarias, porque obviamente a ciertas horas del día en cirugía hay más demanda. Y también hay algunos que les gusta trabajar 4 turnos de 10 horas durante la semana, hacer las mismas 40 horas. Legalmente en los Estados Unidos 40 horas es el tiempo completo, aunque en la mayoría de las situaciones 3 turnos de 12 horas es tiempo completo. A él personalmente no le gusta tomar muchos turnos en que él tiene que reportarse si hay necesidad, lo que se llaman los turnos de llamada. Él trata de tomar absolutamente lo mínimo que se requiere, que es un turno al mes, ¿ok? En este hospital ellos tienen más de 200 enfermeros trabajando en el área de cirugía, entonces hay suficiente gente para que cada quien coja la menor, dependiendo de lo que las personas quieran, cuántos turnos extras ellos cogen. Él dice que hay algunos que les gusta coger más y toman más, y hay gente que les gusta coger muy poco como él, y él coge lo menos posible que él tiene que cubrir. Okay.
We have some questions coming through from the candidates, so I'll kind of throw those in as we go. One of the questions are, can you have different surgical departments going at the same time? So can a cardiac surgery go on at the same time as a general surgery? So could you tell us a little bit more about your hospital, the University of Michigan, and kind of how that's set up in this large academic hospital? And I'll let David translate that one.
Okay, but you have to rephrase that question a little bit, so to help me translate. Rephrase it one more time.
Okay, yep. The question that came through was just, you know, can different types of surgeries, such as cardiac in general, occur at the same time? Okay. And so then I want to learn a little bit more about the University of Michigan and kind of how that looks at a large academic hospital in terms of the flow of their surgical unit.
Okay, very good. La pregunta que Amanda está traduciendo del grupo es que si las diferentes especialidades, por ejemplo, cardiología versus cirugía general, funcionan en el mismo formato, o si esto es algo que es simplemente algo específico para la Universidad de Michigan, y que si nos puede describir cómo funciona el arreglo de las diferentes especialidades.
Yes, many different surgical specialties can be going on at the same time. I work in the main OR that has 32 operating rooms, and every operating room, it's split up kind of into 3 sections, but they're different specialties just utilize different operating rooms in different areas of the OR, and so you can have all different specialties going on at the same time.
Derek dice que obviamente ellos en las salas de cirugía, hay 32 salas de cirugía en este hospital, y obviamente simultáneamente las diferentes especialidades están utilizando diferentes áreas del hospital, así que normalmente simultáneamente se están haciendo casos en todas las especialidades. Do they schedule them for every day of the week, all specialties, or like everything else there is block times and they basically make their own decisions when they run certain specialties?
There's block times that we have surgeries scheduled essentially 6 days a week. So they're during the week in the main OR, we'll do 75 surgeries a day on average. And on Saturday, maybe 20 or 25 surgeries.
And that include all the specialties?
That'll include all the specialties in the main OR. The cardiac OR is in a different area of the hospital.
Okay.
So it doesn't include any cardiac or thoracic. I work in neurosurgery.
Ujú.
And so in the main OR, there's neurosurgery, orthopedic surgery, general surgery,
Okay.
urology. There's other services.
And that's the one with the 32 Rs. And then
Yep.
cardiac has a complete separate suite where
Yes.
they have how many OR suites in there? How many OR rooms?
I don't know, probably somewhere close to, I don't know how many ORs they have, maybe 12 or 14, something like that.
Okay.
And the women's hospital has many ORs as well.
Ok. El hospital de la Universidad de Michigan tiene en realidad 3 áreas de cirugía completamente distintas. En el área donde Derek trabaja se hacen cirugías generales, cirugías ortopédicas, neurológicas, etcétera, pero por ejemplo, ahí no se hace ninguna de las cirugías de cardiología. Ellos tienen un sitio completamente aparte en el hospital, donde hay aproximadamente otras 14 áreas de cirugía donde se hacen todas las cirugías cardíacas, y obviamente el hospital de mujeres tiene también sus propias salas de cirugía donde ellos hacen obviamente muchas de las cirugías ginecológicas y muchas otras cosas que no entran a este hogar. Entonces, en realidad, como el tamaño del hospital, por ser obviamente tan grande, tiene muchísimas salas de cirugía que están completamente divididas y se manejan relativamente independientes unas de las otras. I'm assuming that they are run a little bit independent, one from the other. Lo otro que discutíamos con Derek es obviamente las diferentes especialidades tienen lo que se llama ciertos horarios reservados. Ellos trabajan 6 días por semana. Hay actividades en horario, hay agendadas, a cirugías agendadas de lunes a viernes, más o menos unas 75 diarias en cada una de los días. En los sábados un poco menos, aproximadamente unas 20 cirugías agendadas en el área donde él trabaja durante los 6 días de la semana.
Okay. The next question we have comes from Gloria, and she's asking, she says, good evening. Can nurses perform functions in anesthesia or only circulating and instrumentation?
La pregunta que hace Gloria es, ¿las enfermeras pueden trabajar en funciones solamente como circulantes o como instrumentistas, o pueden también hacer funciones en el área de anestesia?
RNs are just circulating nurses, are scrub nurses in the OR. We don't perform anesthesia. You can do that as a nurse, but you have to go, it's a master's degree. So 2 to 3 more years of school to become a certified registered nurse anesthetist, which is a CRNA in the United States.
Okay. Normalmente los enfermeros obviamente no, en este momento no cubren la parte de anestesia. Sí hay enfermeros que hacen la parte de anestesia. Eso es una maestría que hay que ir a tomarla. Si quieres trabajar en la parte de anestesia, se llama una enfermera practicante anestesióloga. Tiene que tomar una maestría de 2 o 3 años para poderte volver una enfermera anestesista, y si puedes obviamente participar en la parte de anestesia.
The next question comes from Damario, asking, is there another type of nurse doing immediate post-operative care? So could you tell us a little bit about pre and post-operative and kind of what those roles look like for those nurses?
Yeah. Oh, sorry. I'll let David.
Ok, vamos a contar un poquito qué pasa con las áreas antes de hacer la cirugía y post hacer la cirugía, si son los mismos enfermeros o quienes cubren esas áreas. Pre and post and PACU, let's talk a little bit about this.
Yep. Yes, there is another type of nurse providing the post-operative care. At the University of Michigan, the pre-op nurses and the post-op nurses are cross-trained to do each other's jobs. So in the morning, a great amount of them will be there preparing the patients, and then in the evening they'll shift over to the post-op side and they'll take care of the patients when they get out of surgery. Many of those nurses have experience in the ICU and are able to take care of critically ill patients in the direct post-op period.
Hay dos áreas distintas en el hospital. Obviamente es una área que se llama la preoperativa, donde hay muchas enfermeras que se encargan de preparar los pacientes para antes de entrar a las áreas de cirugía. Muchos de esos enfermeros son enfermeros que tienen bastante práctica a nivel de cuidados intensivos, porque ellos rotan de las áreas preoperativas a las áreas posoperativas a recibir los pacientes post cirugía. Y ellos obviamente rotan en las mañanas, coger muchos de los casos que están entrando a cirugía y al final de la cirugía recibir esos pacientes a las áreas postoperativas. Derek, can you talk a tiny bit more about the difference between, we know some of that, but just so people understand the difference between being a PACU nurse versus being a post-op nurse?
The difference between a PACU and a pre-op nurse?
No, post. Like when you are dealing with an outpatient setting where you're just dealing with as a post-op nurse, but you don't work directly in PACU.
The PACU nurses are post-op nurses. Mm-hmm. That's the same thing.
For you guys are exactly the same thing, no difference.
Yeah. The patient goes directly from the OR to PACU, mm-hmm. and those nurses take care of the patient there. They are the post-op. They're the direct post-op nurses, the PACU nurses.
And what about for the outpatient areas? Are there the same nurses that work in PACU? Because sometimes some hospitals tend to be very exclusive on having a different set of nurses who work in PACU versus the ones that they allow to work in post-op, particularly for outpatient surgeries.
Yeah, that's the same type of nurse could do both of those jobs. Mm-hmm. So some of our patients go home that day. Mm-hmm. Many of them do. We're not and the University of Michigan does have outpatient clinics surgical clinics where every patient goes home that day.
Correct. But
so they're all small.
From your main OR, don't you do same day surgeries? People just come there for surgeries and they just get sent home from there anyway?
Yes, that's true.
Yeah. Correct. Yeah. But those patients don't go from PACU, but your PACU nurses and your post-op nurses in that case are basically one and the same.
Yeah.
They're the same group. Okay. Yo le preguntaba a Derek que si ellos hacen alguna diferencia entre las enfermeras postoperativas y las enfermeras que se llaman de postanestesia. Dice que en el caso de la universidad, en este caso son una y exactamente el mismo, sea que sea una cirugía del mismo día, que el paciente sea mandado a casa después de la cirugía, o sea que el paciente vaya a ser admitido al hospital. Las enfermeras que hacen el recubrimiento post-anestesia son parte del mismo grupo postoperativo. Okay. Very good. Amanda?
Our next question comes from Denise. She is a surgical nurse, and correct me if I'm wrong, but I believe from Mexico. So she has a lot of experience, but she says, nice to meet you, Derek. Thank you so much for sharing your experience tonight. 2 questions. Surgeries that are performed during the shift are of specific specialty, or are they rotating? And how long does it take to become a scrub nurse?
Denise le pregunta a Derek, primero le agradece que esté acá, le dice que tiene 2 preguntas. Una es si las cirugías se hacen durante el mismo, dentro del mismo turno, que si son específicas para una especialidad o si se rotan a través de especialidades y cuánto tiempo toma volverse una enfermera instrumentista.
So, how long does it take to become a scrub nurse? We don't specifically train nurses just to become scrub nurses in the OR at Michigan. So the circulating scrub training takes a year there, but you can learn to become a circulator in a much shorter time. So we don't have an area where it's broken out just to be a scrub nurse at the University of Michigan, although you could probably train somebody to do that in a matter of 4 months or something like that.
Okay.
What was the first part of the question?
So the first question is that do you rotate, like you do first neurology, neurosurgery, then you do more general surgeries, or they are kind of being mixed at all time?
So we are in the nurses at the University of Michigan are in an area with 4 specialties. So my area has neurosurgery, otolaryngology, plastic surgery, and oral surgery. So the nurses that are in my area are trained to do all those surgical specialties.
Okay.
Some hospitals you'll be trained to do more surgical specialties than that.
Okay.
But it's easier just to learn how to circulate those, because the circulator does the same thing for almost all those specialties, or a similar thing. It's more difficult to learn how to scrub all those different specialties.
Okay.
And Derek, in a day, would you be just in plastics for the day, or could you, so like, I think that's your question, like, so on a shift, would you just be, let's say, all plastics for the day?
Typically.
Yeah, okay.
Okay.
Sometimes you could go from one service to another.
Okay.
So Derek nos cuenta de que obviamente en la Universidad de Michigan ellos no dividen el tiempo de preparación de ser un enfermero que rota y un enfermero que es instrumentista. En realidad es un programa que ellos hacen completo de 1 año. Él dice que si fueras a dividir solamente la parte de volverte un enfermero instrumentista por una especialidad, se podría en teoría hacer como en unos 4 meses, pero el programa de la universidad es bastante riguroso, en el que más o menos el programa se hace completo, es ser un enfermero circulante y un enfermero con 1 año de entrenamiento que lo hacen completamente. Ellos normalmente, por ejemplo, él trabaja en 4 áreas, él está entrenado en 4 áreas de especialización, él las nombró, plastic, cirugía oral, cirugía plástica, en neurología, y creo que se me olvidó la otra especialidad, pero en todas maneras, obviamente toma un tiempo de solamente prepararse para obviamente cada una de las especialidades, para poder estar bien preparado para una de las especialidades. Obviamente él dice que en otros hospitales un poco más pequeños es posible que los entrenen para más especialidades, pero en este caso obviamente ellos tienen suficiente para poderse especializar un poco más en algunas áreas. Y la otra parte de la respuesta es que durante el día, Amanda le preguntaba si durante el día uno rota de una especialidad a la otra. Dice que no, en general. Si hoy estoy trabajando, estoy haciendo, por ejemplo, cirugía oral, y más o menos me concentro todo el día en ese tipo de cirugías, y normalmente no rota dentro de la misma especialidad. Okay.
Eleanor asked a question, which I think we've already tapped on a little earlier today, but they asked, are there any requirement for nurses to work in the surgical area? Any prereqs needed for those nurses?
Él me está preguntando lo que más o menos ya habíamos cubierto, que si hay algún requerimiento para enfermeros para entrar a las áreas de cirugía. I think, Derek, that you already kind of answered that question, but you want to give it an answer again?
Yeah, when I became a surgical nurse, you had to work as a floor nurse for maybe a year, at least a year or 2 before that. But nowadays they train them right out of school to become surgical nurses. So a person now could go their whole career and only work in surgery.
Okay. Dice Derek que obviamente cuando él se graduó hace un tiempo atrás, las personas normalmente empezaban en un área asistencial del hospital antes de entrar de lleno a las áreas de cirugía. Hoy en día no, ya las universidades están preparando a la gente de manera tal que uno puede hacer su carrera profesional completa en las áreas de cirugía sin tener que pasar. But Derek, I think that the question is a little bit more like, I've been a floor nurse for a long time, and I really would love to become a surgical nurse. There are opportunities for me to do that.
Definitely. Yep. And actually their experience in being a floor nurse for all that time will help them immensely in knowing the total picture of the patient. So knowing everything that's, the patient's experiencing throughout that surgery, so that they would be even more desirable to become a surgical nurse because of their prior knowledge as a floor nurse.
Okay. La pregunta que yo le hacía a Derek, complementando la pregunta de Elmer, es, obviamente, si yo he sido una enfermera asistencial en uno de los pisos en las áreas tradicionales de medicina, pero me quiero volver una enfermera de cirugía, ¿puedo? La pregunta es, claro, obviamente que sí. Inclusive la experiencia de haber sido una enfermera asistencial tiene un inmenso valor para eso, porque conoce toda la experiencia total de los pacientes en las áreas de cirugía. Las personas que quieren transferirse a esas áreas son súper bienvenidas. I'm saying that they are incredibly welcome to come to become surgical nurses.
Yeah, that's correct.
And for the next question, I wanted to throw one in as we kind of work through our candidate questions, but I know that you have certified as a OR nurse, correct?
Yeah, correct.
So as we know, in America, we like to call our alphabet soup behind our name. So can you tell us how you went and got that certification in the OR?
Ok. La pregunta que están haciendo y que Amanda complementó es, ¿cómo hace uno para certificarse como enfermero quirúrgico en los Estados Unidos?
To obtain the CNOR certification, you take a test just like when you became a nurse, and you study from their information the totality of the didactic information specifically pertaining to surgery. So you'll study that on your own for a matter of months, and then take a national exam similar just like when they became a nurse.
Similar to the NCLEX.
And Derek,
yeah,
it
was actually more difficult than the NCLEX. Yeah.
Oh, I can imagine. Did you have to have so many hours in the OR to take this test?
You do, yeah.
And
I
how,
don't
do you
know.
remember?
It's I don't remember. It's thousands.
Okay.
I don't know how many, but
Okay.
Are there special training that the hospital provides to prepare you for the certification?
there is some. I don't know at U of M, but some hospitals do have special training, like classes that you could go through to prepare you for that certification. That's correct.
And the Association of Surgical Nurses doesn't provide some specific training or tutorials to prepare you for that?
They do as well. Yeah, you could partake from their information probably online.
Uh-huh.
Yeah, correct.
And I'm assuming that U of M, like on other hospitals, provide money to help you prep for those.
That's correct. Yep.
Okay, muy bien. Derek dice que para poderse volver un enfermero certificado en el área de cirugía requiere pasar un examen y tener bastante horas en el área de cirugía para poder obtener la certificación que él tiene, que es la certificación de un enfermero en cirugía, el CNOR, que es el título que él tiene. Para eso hay que pasar un examen similar al examen del NCLEX, es el examen de enfermería, es un examen completamente, él dice que inclusive es un poco más difícil, hay que prepararse bien. Hay obviamente guías y estudios para prepararse. Los hospitales obviamente ofrecen ayuda, como yo les he comentado a ustedes, ofrecen ayuda monetaria para hacer ese tipo de educaciones, y la Asociación de Enfermeros de Quirúrgicos obviamente ofrece ayudas para la preparación para ese examen. Él no se acuerda exactamente el número de horas, pero hay que tener un cierto número de horas que uno ha trabajado en el S para poder aplicar para la certificación. You don't remember how many hours you need to have work to be
Maybe
able
it's
to apply?
I don't, maybe 2,000.
Okay.
I'm not sure.
But on that range, maybe somewhere around 2,000.
Maybe, which would be a year. Maybe it's a year. Maybe it's a year or two. I'm not sure.
Okay, yeah, because 2080 is 2,000 hours. What will be in a year? A full year worth of work.
Yeah, I'm not sure. I've been certified for 10 years.
Been a
Okay.
long
So
time.
Yeah, I don't remember.
Okay. Well, we're gonna let Shannon Google it very quickly for us. Okay.
Okay, we'll come back to that one.
Okay. Él dice de todas maneras que ahorita ya vamos a revisar el número de horas exactas, pero más o menos se requiere un año de haber trabajado en las áreas de cirugía para no poder aplicar para la certificación y para poder tomar el examen para quedar uno completamente certificado. But Derek, the next obvious question is, was the pay increase related to obtaining your CNR?
That depends on the institution where you work.
Okay, but do they recognize you as a different level of nurse and the pay is different once you get certified?
They do. They do.
Okay. La pregunta yo le hacía a Derek es, una vez que obtienes tu certificación, cambia tu escala de pago de salarial. Dice que sí, depende obviamente un poco de la institución, pero obviamente sí, ellos cambian, entras a una escala de pago por encima de la que estabas ganando.
And Shannon got our answer. So a minimum of 2 years and 2,400 hours of experience in perioperative nursing with a minimum of 1,200 hours in intraoperative setting.
Okay.
Yeah.
Okay.
Thank you, Shannon.
La respuesta no es un año, sino son 2 años en el área de cirugía con un mínimo de, can you repeat the numbers? You went a little bit too fast for me to remember them all.
My apologies. Minimum of 2 years, 2 años.
2 años. That's and then with a minimum, how many hours on?
2,400 of perioperative nursing.
Okay. Y con un mínimo de 2,400 horas de enfermera perioperativa.
With of those 2,400 hours, 1,200 hours have to be intraoperative.
Y de las 2,400 horas, por lo menos 1,200 tienen que ser como enfermera intraoperativa, which means really being working as an scrub nurse. Okay. Que lo que significa es siendo una enfermera instrumentista por lo menos por 1,200 horas.
Okay, perfect. Get back to some of the candidates' questions. We'll go through a couple more. So Jeanette wants to know, how long did it take to specialize or to be able to move away from like a general surgery area? Do you have to do extra studies? And do they give you that opportunity if that's something you're seeking?
Could you repeat that question again? I'm sorry, I was reading Agnar Candidate's question. I apologize.
Okay. This one's from Jeanette, and she was very kind. She wrote it in Spanish for us.
Okay.
But in English, would you like me to repeat it in English for you?
No,
Or would you like to read the...
No, I was trying to read it at the same time. La pregunta de Jeanette es, ¿cuánto tiempo toma especializarse o poder pasar de un área general a un área de especializada? Jeanette, estoy suponiendo que te refieres de un área general en el área de cirugía a un área de especialización, porque todas las áreas son especializadas, incluyendo cirugía general, se considera un área de especialización. Tienes que hacer estudios extras o tener la oportunidad de pasar a esa área, ir aprendiendo. Gracias. If you want to go from, basically, the way I will maybe translate the question just to complement a little bit the way I would say is that, Derek, if you are, let's say you are working on general surgery and you would like to become a cardiac nurse or I don't know, an orthopedic nurse.
Yep.
How do I manage to do that? If I want to switch a specialty, how do I, what kind of studies or what do I need to do to swap or, acquire an opportunity to switch specialties?
Yeah, there's definitely opportunities to do that. And it's on the job training.
Mhm.
So your employer will train you on the job to go from one specialty to another. So there's definitely, you could learn every specialty there is if you wanted to.
Mhm.
Or you could spend your whole career learning specialties, or you could work in one specialty for your entire career. But both opportunities are readily available.
Okay. So, como para que quede claro la pregunta de Ginette. So, el hospital es aprender a moverse de una especialidad a la otra. Esas oportunidades existen todo el tiempo. El estudio lo hacen en el mismo hospital. El empleador, el hospital ofrece los entrenamientos para moverse de una especialidad a otra. Él dice que uno puede hacer su carrera en una sola especialidad el resto de su vida, o mucha gente le gusta moverse de una especialidad a la otra y simplemente utiliza el hospital para que lo entrenen de moverse de una especialidad a la otra. Si quiero moverme de cirugía general en cirugía cardíaca o algo así, el mismo hospital ofrece el entrenamiento y puedes tomarlo y puedes empezar a trabajar en la otra especialidad. ¿Ok? Muy bien. El hospital patrocina con alojamiento también por cuánto tiempo, ya que no tengo familiares cercanos. Yo, Artie, esa pregunta no estoy seguro si tiene
David,
que ver.
do you want to come back to that question?
Yeah,
Should
yeah.
we? Okay.
Yeah, that's an excellent question.
Joe Audrey, we will come right back to your questions. I'm just going to move down. Chris has a question. He would like to know, do you get training before going to the perioperative area? So if I'm an emergency room nurse and I want to transfer to periop, are they going to give me orientation, and for how long?
Definitely they're going to get, sorry.
La pregunta que hacen es si yo estoy, por ejemplo, en el área de cuidados intensivos, en el área de emergencia y quiero entrar a las áreas de quirófano, la universidad, el hospital me va a dar la capacitación o el entrenamiento.
Definitely they'll train you if you're one type of nurse, to become an OR nurse. For how long depends on what they train you to do, and so how many different specialties they would train you in, and what you're going to do in the specialty. So the training, the time length can vary, and for travel nurses, I don't know what that time length is, but the time length can vary. But they won't let you work as a nurse without the proper amount of training. They'll make sure you're fully trained before they put you out there.
Okay. Derek, most of these people will not work as a travel nurse. They will be working as a full-blown employees of the hospital.
Okay. Yeah, I didn't know that.
Okay, so they will be fully
trained,
fully employed. So they will get the full, the full.
Okay, so it depends on the hospital. Then I would say at least 6 months to as much as a year.
Okay. La pregunta obviamente es los hospitales, como para que les quede todo claro. Esto no es solo el hospital de la Universidad de Michigan, pero los hospitales en general ofrecen ese entrenamiento para transicionar de unas unidades como por ejemplo la unidad de cuidados intensivos o emergencias a las universidades, a las áreas de cirugía. Normalmente dice que la orientación y el entrenamiento independiente de lo que sea aproximadamente entre 6 meses y 1 año. Eso es más o menos lo mínimo que los hospitales usan para transicionarlos a las áreas de cirugía. ¿Okay? Esta Karen is asking,
Oh, yes, about that, the training, that 1 year that we keep bringing up for that training. Is that done exclusively with the hospital, or is that something that if she's interested in, she could go to a community college or university and receive that kind of training? I have to assume that is hospital specific, job specific,
It's
employment
employed.
specific. Yes,
You don't go to university for the hospitals train you for that,
Yes.
yes.
correct? Okay. Karen, la respuesta es esto, tú no vas a la universidad para esto, estos son entrenamientos que los hacen directamente los hospitales, es entrenamiento en el trabajo, tanto hospitales como la Universidad de Michigan, como otros hospitales, como todos los hospitales, ellos ofrecen la capacitación directamente para las personas interesadas y no hay que ir un año a una universidad a especializarse, se toma. La licenciatura, para que te quede claro, es una vez que has trabajado, tú te puedes preparar, tomar los cursos en línea para capacitarte. Lo importante es pasar el examen más que cualquier otra cosa.
Okay, and then somebody wants to know if you've done travel OR nursing. Is that something you've done?
David can ask the question, translate.
Okay. Luis le pregunta a Derek que si él ha sido un enfermero que se comparte, que viaja entre diferentes hospitales a nivel de cirugías.
I have not, but I have worked in 5 different hospitals in Michigan here over the 20 years.
Part of the U of M system or something that you just went through different hospitals?
I worked in 4 different systems, 5 different hospitals and 4 different systems.
4 different systems. Before
The DMC in Detroit, Beaumont, ProMedica,
yeah,
and U of M.
Okay. Luis, la respuesta de Derek es no, él no ha trabajado como un OR, como un enfermero de agencia trabajando, pero él ha trabajado obviamente durante su carrera en 5 diferentes hospitales hasta ahora que ya llegó al de la Universidad de Michigan. Esos hospitales han sido parte de 4 diferentes sistemas hospitalarios en los Estados Unidos. Okay.
So we have a couple of certification questions I'm going to kind of lump it together.
Okay.
Somebody asked, if you're in the perioperative area, must you have a certification? Which yes, the answer is no. They asked a little bit about salary too, so we've already touched on that point. But a great question came across, and I don't know if you know the answer to this, or we might have to do some research, Shannon. To become a CNOR, could our experience in our home country, the country in which we're currently practicing, be taken into account to get the CNOR here in the United States? I'm not sure that you might know the answer to that.
If David wants to translate, I would think so if they were an operating nurse.
Okay.
Okay. So la pregunta de la certificación ya la hemos contestado un par de veces. Obviamente la respuesta está ahí, pero la pregunta que hace Denise, que es la parte interesante, es si yo soy una enfermera que ya está certificada en mi país de origen. Por ejemplo, creo que Denise es de México, que si me van a tener en cuenta esa experiencia o me tocaría volver a comenzar. Entonces, so that's the question for you. So if I am a CNOR in Mexico, will they recognize my experience here, my certification here?
Or if they just have the experience in Mexico. Yes, because I have somebody, I'm just going to scroll up to their name. Jimmy has 20 years of experience already in surgical. So he's wondering if that could translate here for that CNOR certification. So that might be something we'll have to look into and get a little bit more information. Yeah, I would hope so, but I don't know if we have the exact answer.
The organization's called AORN, Association of Operating Room Nurses, and they would be able to answer that.
Okay. So, la respuesta para Denise y para, se me olvidó el nombre de la otra persona, es la Asociación de Enfermeras enfermeras quirúrgicas de los Estados Unidos, es obviamente la que da la respuesta al respecto. Pero la experiencia, estoy seguro, a nivel salarial se la reconocen, eso no es el problema. La pregunta es la certificación, si les toca volver a tomar el examen de certificación o no para obtener la certificación en los Estados Unidos. Y la pregunta la vamos a averiguar, vamos a hablar con la asociación y se las contestamos pronto. Él no está seguro de si les toca volver a tomar el examen o si les aceptan, si usted está certificado en otro país, si les aceptan la certificación. ¿Ok? Muy bien.
We have one last question from a candidate, and I'm not sure what she is referring to. Good evening. In that case, is the training paid for? So,
Yeah.
of course, the orientation and training for the employment is,
Yep.
but I'm not sure any kind of, and some education might be paid for that CNOR certification.
Yeah.
La pregunta es si obviamente el hospital paga por el entrenamiento y la respuesta obviamente es sí, pero I guess the question is obviously while you're going through the training, you're a full-time employee, you're getting a full-time employment, there is no difference on that.
Correct.
La respuesta es obviamente durante todo este proceso, ese año de entrenamiento, eres un empleado de tiempo completo, estás recibiendo tu salario, te están pagando todo tu tiempo y todas tus horas, así que el entrenamiento, entre comillas, es completamente pago. No es algo, es entrenamiento mientras trabajas, así que es parte de tu carrera profesional. Okay? Very good. I think that's all the questions we have.
Yeah.
Derek, is there something, there is a cheering comment that you want to give to the
Sure,
people?
yeah.
No.
The take-home message from me would be this. You can do this. No matter what kind of nurse you were, you can definitely become an OR nurse.
Okay, wonderful.
Go ahead. The institution you go to will train you fully to become a surgical nurse, and you'll definitely be able to do this, to become an OR nurse.
Derek los quiere dejar con el siguiente mensaje. No importa a qué institución usted llegue, si usted quiere ser un enfermero quirúrgico en los Estados Unidos, usted definitivamente lo puede hacer. La institución les va a ayudar y les va a colaborar y ustedes van a lograr volverse un enfermero quirúrgico si eso es lo que ustedes desean. Así es como funciona el sistema acá, a colaborarles para que se vuelvan enfermeros quirúrgicos. Will you recommend, and one final thing, will you recommend becoming a surgical nurse? Is this a specialty that you will strongly recommend for people to consider?
I would, and this is the reason why. It's the ultimate in teamwork. So it's 4 to 12 people working on one patient at one time.
Okay. Y Derek recomienda mucho considerar volverse un enfermero quirúrgico porque es lo ideal en cuestión de trabajar en equipo. Es una cuestión donde tienes siempre por lo menos 4 personas trabajando en ayudándole y colaborándole a un paciente. Okay?
Every member of the team is crucial to every other member, and we all help each other out. And like, I would tell them this. I've been an OR nurse for 17 years. I remember when I was first training, thinking about how is it going to be when I'm on my own, you know, and that day has never come. I'm 17 years and I'm never on my own. I'm surrounded by a wonderful team that together does a wonderful job.
En todos los años que llevo, en los 17 años que llevo trabajando como enfermero quirúrgico, una de las cosas más interesantes y más mejores que yo tengo en mi profesión es que nunca me he sentido solo, nunca me he sentido que está, porque siempre tengo un grupo que está al lado mío, colaborándome y ayudándome a hacer lo mejor para los pacientes. ¿Ok? Muy bien. I think, Derek, we covered the bulk of the answers. So first of all, my personal behalf and on behalf of all our team and the NASH group and on behalf of the almost 80 people that we had here during the presentation today, we really want to thank you for coming and taking the time to telling us a little bit about what it is to be a surgical nurse in the United States. We really appreciate that a lot. I hope that we have an opportunity in the future to invite you again, to talk about something in particular, but we definitely love that you came. Thank you very much. Okay.
You're welcome. It's been my pleasure.
Okay. Estoy agradeciendo a Derek haber venido y habernos contado un poquito cómo es trabajar como en las áreas perioperativas de los hospitales y que lo invitamos nuevamente que nos acompañe en un futuro para a charlar un poco más sobre las áreas. Amanda?
Right. Thank you so much for your time tonight, Derek. This has been amazing. Next week, we have a midwife coming. For those of you who are interested in midwifery, we have a midwife coming to speak to us. And then the following week, so the last week here in May, we have BSR Idiomas. They're going to come and talk to us about how to listen better in English, how to understand, well, me when I talk. So how to understand English better. So do not want to miss these upcoming events. So come check us out again next Wednesday.
Ok, Amanda nos invita a todos. La próxima semana el seminario es sobre, está invitado un enfermero en el área de obstétrica, en el área de parteras. Va a venir a contarnos cómo ser, cómo es la enfermería para las personas que están en el área de obstetricia y parteras. Los invitamos para el próximo jueves, donde vamos a charlar sobre enfermería obstétrica, y en 2 semanas tenemos al director de la academia que va a venir a contarnos estrategias de cómo aprender y escuchar mejor inglés, cómo aprender a retener y oír un poco mejor lo que estamos escuchando en inglés. Esos son los próximos seminarios para las próximas 2 semanas. Again, on my behalf, on all of my team behalf, thanks again, Derek. Thank you very much. And, buenas noches y muchas gracias a todos por haber atendido el seminario de esta noche. Los esperamos el próximo miércoles a la misma hora y que sigan acompañándonos todos los miércoles. ¿Ok? Muchas gracias a todos.
Thank you.
Thank you, Derek. Thank you very much. Really great information.
Thank you. It's been a pleasure.
Okay, thanks.
Thank
Night,
you.
everybody.
Bye.
Goodbye.
Night. Thank you.